Hi, my name is Lisa Kemp, and I'm the Director of Programs for Atma Psychedelic Healthcare Solutions. Welcome to the Compassionate Witness Orientation. This orientation is designed to equip you with the knowledge, skills, and understanding necessary to provide unwavering support and empathy to individuals undergoing transformative psychedelic experiences. As a compassionate witness, you'll work in partnership with the nurse to facilitate a safe, nurturing environment for our clients, contributing significantly to their emotional well-being and their therapeutic journey. This training will cover essential aspects of your role, from educational requirements and key skills to specific duties and responsibilities, ensuring you're well prepared to offer compassionate, non-judgmental presence throughout the therapeutic process. The field of psychedelic-assisted therapy demands a strong educational foundation coupled with ongoing professional development. As a compassionate witness in our organization, you've already met the foundational educational requirements, and we appreciate your commitment to continuous learning. There's a great deal of diversity in the Atma Compassionate Witness team. These might be individuals with psychedelic-assisted therapy training from a variety of backgrounds who are seeking experiential learning opportunities. There might be unregulated or regulated health professionals who are completing a practicum from a partnering psychedelic-assisted therapy education provider. They might be psychedelic-assisted therapy trained volunteers with various backgrounds. We also work with co-care partners. These are therapists that we have formal partnerships with, and it enables the therapist to participate in their client's psychedelic-assisted therapy journey. They may participate in both psycholytic and psychedelic treatment sessions. It's important to point out that nurses are also compassionate witnesses in addition to their required responsibilities when they're in a psychedelic session. The compassionate witness serves as an anchor of support, empathy, and non-judgmental presence during psychedelic experiences. This role is fundamental in establishing a foundation of trust and safety, allowing clients to fully engage with their therapeutic journey. By providing unwavering emotional support, the compassionate witness helps create an environment where profound healing and personal growth can occur, enhancing the efficacy of the psychedelic-assisted therapy process. These are the core skills that form the foundation of an effective compassionate witness. By cultivating deep empathy, maintaining a calm presence, and respecting cultural diversity, compassionate witnesses create an environment where patients feel truly seen, heard, and supported throughout their psychedelic experiences. These skills facilitate profound healing and personal growth, enhancing the therapeutic process. This slide outlines the duties and responsibilities: establishing a safe environment, providing constant support, practicing non-interference. This can be challenging depending on your background, ensuring to monitor the client's safety at all times. There's a careful balance of presence and non-intervention, which is crucial for facilitating transformational experiences and promoting healing. In the next few slides, we'll discover how to create a safe container, hold space during the psychedelic session, and how to practice non-interference. Now, client preparation is very important prior to someone seeking psychedelic-assisted therapy. You may recall from the general orientation that clients interact with several members of the interdisciplinary team before their medicine session. Clients receive information and support from an intake specialist, the prescriber, the nurse, and/or their therapist. They receive an orientation guide and a self-care toolkit. They also come for an in-person or a virtual orientation prior to the medicine session, and they've already completed required forms and have been walked through what to expect. Establishing a safe environment for the client is very, very important. The compassionate witness works in close partnership with the nurse to establish a safe environment. You will refer to the workflow procedure psychedelic session to guide you in how to do the following: how to set up the room, ideas about how to collaborate with the nurse about the client, how to prepare the client before receiving the medicine in case they have outstanding questions or concerns. Also ensuring that you and the nurse are grounded prior to the client arriving. So how do we set up the room? Again, you'll refer to your psychedelic session workflow procedure, but it includes ensuring that the lighting is dim and inviting. There's ambient music. There'll be a cover on the pillow and a weighted blanket. There'll be a little bit of monitoring equipment that we set up for the nurse. The client will have eye shades and they'll have headphones to play a specialized playlist. Each client is provided a journal before their first treatment session. And clients may also bring objects of comfort. They're encouraged to. So having some space available for them to put those away is important as well. A client might prefer to be on mats on the floor or on a couch as opposed to a treatment recliner. It all really depends on what's been discussed ahead of time. So there's a little bit of prep before the client has their medicine. The nurse will need to do a pre-treatment assessment, ensure the necessary consents are in place, and then they need to prepare the client's medication based on their weight. The compassionate witness will continue to help settle the client. They might assist them to the bathroom and set them up for comfort. This means adjusting the chair and offering the pillow, placing the weighted blanket on them and checking in with them it feels right. These seemingly small gestures help the client ask for what they need to be comfortable rather than it being up to them. You might try saying, why don't we try tucking in your arms and your legs, see if you like the way that feels. Or if you're more comfortable, maybe you want your arms and feet out. And when they come for subsequent sessions, they're often very empowered to be able to tell you exactly what's comfortable to them. It's very important to assist the client with a grounding exercise. The nurse will gently slip back into the room and join this grounding exercise, taking cues from the compassionate witness for when the medicine can be administered. Creating a safe container is very important. So what is grounding? I've chosen this quote by Michael Daniels. It's a sense of being fully embodied, whole, centered and balanced in ourselves and in our relationships. It's also a connection to the authentic self. In this sense, consider that you're grounding yourself and you're bringing everyone along with you. Use your intuition and your felt sense to pace this guidance in a way that allows time and space to embody the words. In your workflow procedure, there are other options that you can try, but next I'd like to take you through a bit of a grounding exercise. I'm going to provide an example for Charlotte. You might find it helpful to close your eyes and follow the prompts to get a sense of what intuitively works for you, to give you a sense of grounding. Use your intuition to know what feels right. Usually 7 to 10 minutes is appropriate for this part of the session, but there have been clients that required a little bit more time to settle. Charlotte, now that we've set the volume on the headset, I'm going to pause the music for now. Can you hear me with the headset on? Okay, good. I'm going to guide us all into a grounded, relaxed state. Then I'll begin the music, and soon after you'll become aware that the nurse is present to provide the medication. Remember to allow yourself to sink into the experience with curiosity rather than judgment. At any time your mind wanders, you can always come back to your breath, or you can touch the stuffed animal that you brought to help remind yourself where you are and that you're safe. And always remember, we're here with you. Well, let's start by taking a breath now and exhale with a sound. Now breathing normally for a moment. When we take our next breath, on the exhale, allow your body to fully sink into the chair, tuning into your body to see if there's any places that might need adjusting, and go ahead and take a moment to do that. Let's tell ourselves right where we are right now in this moment. Let's remind ourselves what we are here to do today. Know that this intention has been heard, and we can simply just be during this experience. And as we breathe normally, let's take a moment just to feel in our body how it feels when we have this one thought. Think of one thing that you're truly grateful for. Notice the pause in between to allow people to really absorb what you're saying, and allow each exhale to help them to drop into more relaxation. And you'll begin to get to know by practicing this, even with people at home, that your intuitive sense will tell you when the room has been co-regulated. That's when the compassionate witness can cue the nurse, if they've been out of the room preparing the medication, to when it's appropriate to start. You would start the music, allow it to play for a few minutes with them just noticing their breathing, and then begin medication administration. Holding space is many things. It's continuously grounding yourself in the present moment and asking for the guidance to help support the client in their journey. It's as though you're creating a protective bubble around them that blocks out distractions, judgments, notions of time. I heard the quote, "It's sharing your calm to facilitate nurturing connection." And it's unwavering but indirect support. Just kind of run over a few scenarios that might happen, things that you might expect when you're in the psychedelic session. Vast majority of people are quite deep in their experience and are quite inactive. They may lay there peacefully for the entire time. And this session takes probably about 90 minutes, sometimes up to 2 hours. Clients are quite deeply in their experience. So again, you share your calm. Continually ask for guidance during this time. You might have a client who's quite verbal in the experience. They might be almost narrating what's happening, which is quite fascinating. It's important that the nurse captures these notes because they're very useful in integration sessions. Be very careful that the client isn't necessarily speaking to you or expecting an answer. You're there to observe. Now, we have had clients who do wish to converse. Sometimes they're having a hard time dropping in. They're asking themselves questions like, why don't I see colors? Or why am I floating in darkness? I thought I would see colors. They might want to ask you questions and have you answer them back. And this can be really challenging not to get pulled into that. Now, again, we go over this in the orientation and what to expect, but they still might need some gentle reminders. The question that you're answering is a very important question for you to answer from within yourself. I invite you to ask it to yourself and give some space to hear the answer. And we'll be here to support you. Many clients also might need to use the bathroom during the session. The majority of the ketamine is excreted through the kidneys. Depending on the person's metabolism, they might have to have a bathroom interruption. Again, something that we've discussed ahead of time. We tell the client, don't fight it. If you feel like you have to go, we will assist you. So you simply remove the headphones. They might choose to keep their eye shades on and be guided completely by you because they might be sensitive to light. That's perfectly fine. And you assist them to the bathroom and back into the chair and can help them turn inward again with just some gentle guidance. There are times where you have a very active client during the experience. It's not unusual to see clients reaching out and grabbing things, or even, crouching in a fetal position, grunting, screaming, and just moving energy. That's all completely normal. Again, we prepare clients for that. We let them know also that someone else in another room might be having a more active experience, and that is okay. Again, we're practicing non-direct support. If the client reaches out to you and wishes to hold your hand, or they need to hold their object of comfort, you can redirect them that way. And sometimes even just holding onto the chair and slowing your breathing to help co-regulate the client are all ways that can benefit them. On occasion, if a client is active enough that the chair is not comfortable or feels safe, one of you can also go and get some mats or blankets and pillows and help the client to the floor if that feels more comfortable for them. The client's state post-experience can really vary. As caregivers, it may feel natural to try and help find solutions to their questions. Or even as a therapist, it might be tempting to engage in active therapy. However, it's really important to remember that the client may be still experiencing waves of the medicine and just finding their landing. Now, the client has had preparation and orientation to know some things to expect, but as many of us know, this can be an extraordinary experience that they don't have the words for. So they might need some gentle guidance. Some things that you may consider. Both the compassionate witness and nurse will remain calm and quiet to allow space and stillness for the client to process the experience. Remind the client to take their time in silence and sit with the experience. You might want to place art supplies or the client's journal or a fidget near the recliner and invite the client to explore these if it calls to them. If they do wish to talk, offer a listening ear. You can gently assist them to redirect the questions back to themselves with curiosity. You may even offer to write these things down in the client's journal. Random words and thoughts, things they might have seen that don't necessarily make sense now. These are really helpful for the client in their integration process, and they will make sense eventually. You can also offer to give the client some time alone in the room. If your felt sense is that's what they need, you could say, I can leave the room for a little bit to give you some time. Does that feel right to you? Would you like me to come back in 5 or 10 or 15 minutes? That gives you a sense of what it is that they're needing and builds their confidence to ask for what they need. We always provide snacks and hydration after a session, so that might be an opportunity for you to go get those things, or just to simply say you're stepping out to bring it back, asking what they're in the mood for. Or you could just bring a basket of assortments and they can choose from there. When it feels complete, it's important to close the container with some grounding and encouraging words. Something simple like, let's close our eyes for a moment. Let us know that what unfolded today is for your highest good, and it will fall together in the days and weeks to come. For today, we are complete and wish you well on your healing journey. Something simple like that. After the client has been escorted to their designated support person and they've safely gone on their way, there are a few duties that the compassionate witness and the nurse will do. And during this time, they have an opportunity to debrief. How did the session go? What were some moments where you didn't know what to say, where you might say something different next time, or you can offer some advice back and forth to each other with great compassion. We're all learning. Every session's very different. We all have so many different experiences to relate to. And again, you'll use the psychedelic session workflow procedure to guide you on how to change the linens, do some disinfecting, and set things up for the next client. Something to remember throughout all of this is upholding ethical standards and maintaining professional boundaries are paramount in the role of a compassionate witness. These considerations not only protect the patient, but maintain the integrity of the therapeutic process. By adhering to strict confidentiality, establishing clear boundaries, practicing cultural sensitivity, and ensuring informed consent, you create a safe and trustworthy environment for patients to explore their innermost experiences. Again, this can be challenging if you're a therapist and are compelled to do therapy or counseling, or your role is as a nurse and you feel compelled to help answer the questions and solve problems. This takes practice. We all become better at this role as we gain experience, but we start somewhere. As a compassionate witness, your own well-being is crucial to effectively supporting others. Engaging in continuous learning keeps you at the forefront of best practices, while personal mindfulness practices enhance your ability to remain present and emotionally regulated during intense sessions. Peer support provides valuable opportunity for processing experiences and preventing burnout. Maintaining a healthy work-life balance is not just beneficial for you, but essential for providing the highest quality of care to your patients. By prioritizing your own self-care and professional development, you ensure that you can consistently offer the empathetic, grounded presence that is the hallmark of an effective compassionate witness. Before some final messages, I want to share a quote by Ernest Hemingway and invite you to close your eyes while you soak in the words. In our darkest moments, we don't need solutions or advice. What we yearn for is simply human connection, a quiet presence, a gentle touch. These small gestures are the anchors that hold us steady when life feels like too much. Please don't try to fix me. Don't take on my pain or push away my shadows. Just sit beside me as I work through my own inner storms. Be the steady hand I can reach for as I find my way. My pain is mine to carry. My battles are mine to face. But your presence reminds me I'm not alone in this vast, sometimes frightening world. It is a quiet reminder that I am worthy of love, even when I feel broken. So, in these dark hours, when I lose my way, will you just be here? Not as a rescuer, but as a companion. Hold my hand until the dawn arrives, helping me remember my strength. Your silent support is the most precious gift you can give. It's a love that helps me remember who I am, even when I forget. And finally, as a compassionate witness with Atma, you are a part of a consciously connected community. We are working in an ever-evolving field with a fluid team of staff and partnerships who are all endeavoring to continuously enhance client experience. This fluidity can be challenging to adjust to, but it's essential to our success. So we are compassionate witnesses for one another in the Atma team and with our partners. It's an expectation that we offer the same level of understanding and respect for our diverse backgrounds and experiences that we come with. That we treat one another with compassion, non-judgmental support, encouragement, assistance, or patience, or whatever is being called for in the moment, so we can grow within ourselves and as a team that provides excellence in care. I want to thank you for your time today. I wish you all the best in your role as a compassionate witness. I've included my contact information if you need anything or have any questions. Thank you again for joining our team. Connect back to your team to coordinate next steps for completing your orientation.